Welcome to the Orthodontics in Summary podcast, where Farouk brings you the key points and understanding of orthodontic webinars, conferences, and papers in a concise podcast with your host, Farouk Ahmed.
Hello all, welcome to another episode. Today's lecture is entitled Missing Teeth and Bony Deficiencies, Exploring Dilemmas and Dogmas. This was part of the Saudi Orthodontic Society's ongoing webinar series delivered by Mark Wertheimar. Now this lecture had lots of content, so it's going to be divided up into two halves. The first half looking at hypodontia and the factors of space opening and space closure, and the second half will look at the clinical management of space opening and space closure, as well as how to manage bony deficiencies. So starting off with hypodontia, so the prevalence is around 2% by Cockich in 2005, but has been reported at 6 to 8% in the population. Now there are some dogmas surrounding space opening and space closure. The first is of canine guidance being sacred. Mark described how the evidence does not support one occlusal scheme over another. However, there is some evidence that suggests that the canine inclination has an impact upon parafunction and increased muscular activity. This relates to the study by Sugimoto from 2011, and it showed that having a degree of freedom in occlusion, i.e. when patients are in centric relation or intercuspation, there is some movement which is possible, allows for lower muscular activity to take place. So upper canine inclination seems to be a key factor as opposed to its position. The second dogma or idea is that the proprioception of a canine is somehow special. Now, proprioception relates to how the sensory input allows the tooth to be located. There's an idea that canines allow greater proprioception to take place, therefore have a greater contribution to the reflex arc. Now, the reflex arc is the reflex process of how we chew. It takes a stimulus from the teeth and other sensory inputs to coordinate structures when it comes to chewing, but also the chewing force. Now, Mark stated there is no evidence to support that canines have this special proprioception. Furthermore, there is no evidence to state that having the first premolar or the bicuspid is any less functionable in the position of the canine as the canine itself is. Mark went on to explore the literature. There was a systematic review by Abduo in 2015 and one prior to that in 2013, and it concluded that neither of the canine group function is a naturally occurring event. Both occlusal schemes are dynamic, meaning that they change as the patient goes through their years, but also in the day as well. Neither occlusal scheme is pathological or therapeutic. And the most crucial factor from this review actually relates back to the previous point. The degree of freedom in occlusion seems to be the key factor to health. Next, Mark went on to explore the ideas behind implants. Now, the idea put forward at times is that implants are the most ideal prosthesis to have. And he described the issues of implants, but also the timing of orthodontic treatment. So, the issues with implants, the main issue is infraposition of the implant. Well, what is that? Well, that's where the vertical growth continues of the adjacent teeth and the dental alveolus, but the implant doesn't change in its vertical height. Therefore, it's relatively infra-occluded. Now, this phenomenon on infraposition has been stated to be the highest between the ages of 10 to 30, and then less so, but still observed in the age group of 30 to 40. That was Schwartz average from 2015. Now, what is the ideal age to place an implant? Well, it varies depending on the patient. What is clear is that the implant should be placed when growth has completed. That can be assessed through serial radiographs. Other problems with implants, well, we described the infraposition, and that affects the position of not only the crown, but also the gingiva as well. Other issues relate to tooth wear and also loss of contact points due to this progressive infraposition that takes place. That was Papa Giorgio's systematic review from 2018. Implant failure has been reported at 5 to 10% long-term wise. That's by Poblas in 2019. So what is the best time to carry out orthodontic treatment? Well, some ideas put forward are we carry out orthodontic treatment when we normally do and we restore at a later stage. This concept of 2 stages. Now, there are risks associated with this delay in between having orthodontic treatment and placing that restoration. There are risks to the change in the root angulation. There are bony changes that can take place as well. Now, most significantly, this is if spaces are greater than 6 millimeters. We know that a consequence of this is that when the actual restoration and implant are placed, 60 to 80% of these cases require some form of bony augmentation to allow a successful implant to be placed. That was Bertel's study from 2017. Therefore, considering the evidence, one should actually delay the timing of orthodontic treatment for patients who are missing teeth if an implant is planned, so it's a single stage, i.e. they complete their orthodontic treatment and then have the final restoration placed. Well, what does the literature say overall about space opening and space closure? What was interesting is that Mark reviewed an extensive amount of literature here and said the evidence from 1975 by Nordquist to 2016 systematic review by Silveria supports the same idea, that space closure has slightly better aesthetics, periodontal outcomes, and there's no issue with TMD. The non-orthodontic literature also supports the same idea of space closure giving better periodontal outcomes and aesthetics. But what do patients think? Well, patients' actual preference has been shown by Cardi in 2016 that shows that patients do prefer the aesthetics of space closure. That's it for this first part of this webinar summary. Look forward to the next episode, which will be coming out shortly. If you find this useful, please do subscribe and look forward to the next episode.